Good morning, everyone. Thank you for being here. So nice to see you. And I love this topic. And I gave it once before at Tutu's house in Waimea. And so this is a revised edition. I found that people really wanted to understand more about the medical system and the options that we have available. So that's what I hope to do today, is to give you a little bit of a insight from a state perspective, legislative perspective, but also from a patient perspective. So you'll hear both today. So that's why I rephrase this from what is the difference, because I could be sarcastic and say an M and an N. Or I could say, what are the differences? And there's so many differences. Compare the two types of medical practices. We're both physicians, and we both provide medical care. It's just how that care is brought to you and how it's presented to you. That's the difference, really. So I'll go into detail about that today. But first, who am I and who am I to speak about this topic? I am a naturopath, so that's a disclaimer that it might seem somewhat biased, because I do love what I do very much. But I also want to let you know that I worked in the MD world for many, many years. I worked at the Queen's Medical Center on Oahu for 6 years, and I decided to leave after, this is dating me, but after the medical system changed, the insurance becoming more involved, and they were dictating that we can only spend 10 minutes per patient. And I thought that was an injustice to mankind and to the patients who really needed it, because this was trauma care. And so everyone was in a period of quite a lot of stress about themselves, but also their loved one and what happened to their loved one. I saw a lot of surfing accidents back then, because we'd body surf, and visitors would come in and body surf and snap their necks, so they were instantly paralyzed. So I couldn't do that. I couldn't spend just 10 minutes with the patient. So I decided to go outside and did my own private practice for a while. So, and that was interesting too, because I didn't know that they had already schemed. So rehab hospital you had to go PT, OT, speech. They had their own system. You couldn't have an outside system. It wasn't affiliated. So I worked then with just children, and moms and dads would bring their kids in, which was still a lot of fun. I had to be a kid again. But it's nice to be back in medical care in my own practice, and I see all ages. So I also, besides that experience, was also trained by an MD. I met him when he was 75 years old, and I asked him, should I be an MD or ND? And he said, I wouldn't wish MD on anyone, because it had changed so much. So I am a naturopath, proud of it, and I hope you guys understand why by the end. So why is this important? Is because especially here, we have a freedom to choose how we want to be treated, what kind of care we want to receive. And so that's important when you are facing with a health crisis and a decision what your options are. Some people don't know there are other options available to them. So this is nice to know. But it depends on what state you live in. Not all states recognize naturopathic physicians. Actually, only 18 out of 50. Hawaii is one of them, yay! So, but then the next question you have to ask as someone that's exploring options is, what is the scope of practice? So in the state of Hawaii, we have prescription rights, but not for narcotics. We have a medicinary, which means in my office I have a full supplement line, homeopathic medicine, herbal medicine. So I have a lot of tools, a lot of medicines to help my patients get well. We can do IV, intravenous means IV medicine, in the office. So people might know about that for chelation, for detox from heavy metals, or high dose vitamin C if we're fighting cancer, maybe one of the many, many cancer options available. But you need a separate certification for that. So if you're looking for a naturopath, not all naturopaths are certified in IV medicine. That's another question to ask if you're looking around. Acupuncture in the state of Hawaii, we're not allowed to do unless we have a separate degree in acupuncture. In the Arizona where I practiced first before moving back to the islands, I could do acupuncture, and I really, really miss it. So I might go back to school sometime before I'm 80 and get that degree. The homeopathic medicine is also recognized under the umbrella of a naturopathic doctor, but not in its own entity. So in some states, there are such a thing as homeopathic physicians, not in Hawaii. But I can do it under my practice, so that's nice. And I do like that form of medicine as well. And then physical medicine is a whole branch of different types of medicine. Physical medicine includes chiropractic, which we can do. A lot of people don't realize that we can do chiropractic under our existing license. I choose not to, because the chiropractic I learned in medical school was more of the twisting and I thought that was a huge liability, and also not treating the underlying cause of the problem. But I do some physical medicine, such as ultrasound, sine wave machine, so some of the electrical forms of treatment to help with stiffness in the joints or muscles and whatnot. So I do other forms of physical medicine. Okay, nitty-gritties. Sometimes I get asked, are naturopaths actually physicians? Yes, we are. We still have to do pre-med, and we still have to do a 4-year medical education, so our training is just as extensive. We can also be specialized. That's fairly new in the world of natural medicine. There's naturopathic doctors that are specialized in oncology. There's naturopathic doctors that are specialized in pediatrics. If you ask me what my specialty area is, I would say immunology, but mostly just for my training. It's not a separate credential I hold behind my name. We both are able to diagnose conditions and prescribe medication and order basic labs and order imaging. What's different is we do not have to do a residency, and in the MD world, everyone except for ER doctors should do a residency or needs to do a residency. I chose to do one just because I felt like it was important to be governed and guided by a seasoned naturopath before I got out on my own. We do not have hospital privileges, and that's kind of a thing of the past, because most MDs don't have hospital privileges anymore. I just dated myself by putting that in there. Most hospitals now hire their own physicians, and they don't bring outside physicians in, like they used to in the good old days. Remember those days? They used to say, your doctor is in the, yes?
How many hours training in nutrition do you get?
Haha, that's a good question. Did everyone hear that question? We have all 4 years of nutrition training, and we'll talk about that. Yeah, class every year, at least one class every year. And there's different types of nutrition. We have nutritional biochemistry. So what happens when you eat a food? Where does it go? What parts of the body utilize those? Where is it digested? So it's in our gastrointestinal class. It's in our pathology classes, what causes diseases. So good question. We have it every single year, which is different from an MD.
Yeah, I heard MDs might have 4 hours training in nutrition and they go out and start their own diet. That seems to be happening a lot.
That's right. That's right. Unfortunately, we have limited insurance coverage, especially if you're a veteran or over 65. Medicare, Medicaid, the VA system doesn't recognize us. So we don't have a choice. We can't say, I'd like to service the veterans. They do not recognize us. So hopefully that will change. I have a vet that I saw just because they were so worried about, his wife was so worried about his condition, and she's going to go meet with the legislature. She's going to take it to the top because she thinks this should be covered. So hopefully it'll change. Only takes one person to create change, right? We cannot prescribe narcotics, which is what I said before. And I don't know, a lot of people don't know this, but testosterone would be considered a narcotic because it was an abused substance. But I just saw on our state website page that in 2017, end of the year, October, that we could prescribe. So I got to ask about that. But before, we couldn't prescribe testosterone for anybody. We can order specialized labs, but so can MDs. But typically, they don't understand them, and so they don't order them. So ours would be like hormone urine testing, the salivary test for adrenals, those are the Boston Heart tests for cardiovascular health, which are all great tests. Some MDs order that last one I was talking about, but not too many. We'll utilize tests that are outside of clinical labs or diagnostic labs.
Can you do those brain pictures that Dr. Ahmed takes for ADD?
Oh my goodness. I wish. That's called a SPECT scan. And I met him, and I'll tell you, remind me to tell you a story at the end. He's a psychiatrist that went outside of his profession, and he received a lot of slack for it, but now he's doing quite well and quite wealthy. But he said, I'm a psychiatrist, and we're the only profession that doesn't look at the brain doesn't look at the organ that we diagnose. So he said he developed this, not developed it, but he had this technique called SPECT scanning, which wasn't accepted by imaging, but he set up a clinic, and it became so popular that he set up clinics all over the U.S. He just needs to put one here. Yeah, there's not one here, but there's one in California, is the closest one. So, yeah, but he did create a pretty good diagnostic written tool that I can use with my patients to kind of zone in on where the part of the brain might be damaged. So that's really nice. It's more like thermal imaging. Yeah, it reminds me closer to thermography, in the sense that parts of the brain will light up and have different colors, and the part of the brain that's not being utilized is shrinking. His images, they remind me of cotton candy, right? And and then how cotton candy gets wet and just.
I've done quite a bit of study with nuclear imaging, and it's real big on the mainland, and I'm pretty sure you could probably suggest it.
Yes.
I don't know how, insurance-wise.
That's the problem. That's the problem.
Expensive.
Yeah. That's the problem, is that we can order it, but oftentimes we don't order it because it's prohibitive for the patient. We are the oldest form of medicine. A lot of people don't realize that, how old our medicine is, and I'll talk about that when we talk about some of the treatment modalities I have. They date way, way back, but they're still used and they're still highly effective, so I like to use them. And like I said, we need to be licensed in the state that we work in. And like I said, there's only 18 states that license naturopathic doctors. If you choose to live in a state that's not licensed, then you can't call yourself a physician. You're more like a health coach. So again, the practice, like I mentioned earlier, the scope of practice varies per state too. And what's big and bold in the differences are philosophy. So we'll mosey on and talk more about that. So now I'm going to turn it a little bit to what happens when you become I want to explore natural medicine. What would it be like if I was a patient? What would I experience? So there's two things, the philosophy and the medicine. And the philosophy of natural medicine is really, this is our oath when we graduate from medical school. This is what we basically vow on the Bible that we will practice. We must treat the whole person. And I like speaking at the church because we're talking about the spirit, and we're talking about the essence of the person and their desire to conquer and to get past this disease process so they can do more of what they want to do with their life. They want quality of life. They want to get out of pain. They want to have more function. They want to be moving more. So I have a patient that I actually lived in town, so she drove by my office quite frequently, and she really liked to do hula, but she was arthritic, and so she couldn't get her hands up full extension. And so she was so frustrated that she decided, what the heck, I'm just going to go in and see this doctor over there and see, she's right there. What do I have to lose? And I would say within 2 months, she was back to doing hula, pain-free, no problem. So treat the whole person. And oftentimes when I do a consult, it's about what's blocking them from making progress. And sometimes the obstacle is their own fear or their own trepidations. And so that's where the mind comes in. And the body is their physical body, what's keeping them from being healthy. Is it gastrointestinal? Is it arthritis? Is it heart? Is it lungs? What is it? And then teaching. I think a great example about teaching is when I go through lab results. A lot of my patients say nobody has gone through the lab results like you did. So now I understand what RBC means and WBC means, and I understand what's optimal and what's not healthy, and thank you for explaining that all to me. What is AST, ALT, all those abbreviations that are on a typical blood draw sheet. And then I also want to help my patients not have to go through this disease process again. So how did they get there? How do we not let them go that direction again? So becoming healthier overall. And then the medicines we're using should be healing and not detrimental to their health. Also, sometimes in the healing process, it's a step-by-step process, and so you can't just throw everything in the kitchen sink at them at one time. You have to take it in a systematic pattern. So that's what that means. And then by doing that, we're not going to cause any harm to the person or to the being. So how are you treated? Now, this is what's really, really different. Instead of 10 minutes, we spend an hour and a half with you on your first visit to the office. And it's just the doctor and the patient together. And that's where we go through a really detailed history. It's where I become a medical detective, because I want to figure out, how did this happen to you? When did it start? How do we get to go away? Is there more than one causative agent, which often is the case, because we're very complex beings in a complex world. And so what are the things that cause this condition to occur, and how do we make it go away and stay away? And by doing that, oftentimes we can start the treatment the same day. You'll definitely have a sheet that will tell you what foods would be optimal for you to consume, what foods will aggravate your condition, so you can go home and get started right away as well. All right, so treatment options. I'm going to start with the oldest and go to avant-garde treatment options. So the first one, you already mentioned it, is food. And some people think, how does food relate to medicine? Well, way back in 431 BC, Hippocrates, who's the father of medicine, said that food be thy medicine and medicine be thy food. So I can look at this picture and you can say, oh, this doctor just wants me to eat vegetables. I hate vegetables. But you can also look at this picture and say, garlic and onions are hypolipidemic and they're antiviral, and so they'll be naturally blood thinning by the nature of them. I see mushrooms, and those are immune boosting. So I see something different than maybe what someone else sees. So we use the foods for the medicinal properties that they have within them. Cancer is a metabolic. Cancer is the #1 health issue facing us as a nation, and seems to be an epidemic, right? So here's Ernest Krebs, and he's a junior. Senior was just as motivated as the junior was, as his son was, about finding a cure for cancer. And they said cancer is a metabolic disease. That is obvious. So what's the definition of metabolic? It's really digestion. It's really utilization of food. It's, are you consuming enough? And then once it gets in your body, are you able to utilize it? Is your whole system working to be able to put it where it needs to go to do its job, to keep you safe and healthy? So it's mostly their vitamin and mineral deficiencies. And case in point is, over history, again, looking back at history, scurvy, 1550 BC. This usually happened to sailors that are out at sea for months on end, and they would run out of fresh produce. So as a result, they became vitamin C deficient. Many, many died from being vitamin C deficient. But all they had to do is get to land and can start consuming fruit, and the disease will reverse itself. Another disease that was very, very popular in 1855 was pernicious anemia. And we still see anemia today for mostly the people who are going more towards vegetarian and not consuming meat, because B12 is highest in red meat, and so is folic acid. And there was no treatment for it until 1956. Then you can have a pill, you take a pill for it. So the same with scurvy. The vitamin C was not put into a capsule form until in the 1940s and 50s. The other diseases, pellagra, 3 Ds, dementia, dermatitis, and diarrhea. And that was from a vitamin B3 deficiency, of vitamin B. Niacin, I prescribe a lot in my office because it treats so much more than pellagra. Obviously, it helps your cells be deficient, sufficient of minerals, but also just your whole cardiovascular health. So it will help with the with the help of the LDLs in your cholesterol pathway. So this was a naturopathic doctor at a naturopathic conference said this, and I wasn't going to go listen to him speak because he was speaking on diabetes, and I thought it was just too basic. But he was a very persnickety about where his patients receive their food from, and he was basically talking about whole food, not the coconut water, the coconut, right? And getting the water from the coconut yourself, not processed in a little container that you find in a store. So that's what he was saying. Can't talk about food being healthy or not healthy unless you know how it was prepared. And I think if you read the paper or listen to the news over the last 4 or 5 months, that's really come up and up and up again because of all the salmonella and listeria and the tainted onions in the foods. And so one of the articles I read, it was saying that we don't know, our food comes from so far away and gets mixed and mixed and mixed that it's hard to trace where the tainted food product was. And it was one item it was onions, happened to be onions, but it was made into beef patties and chiquitos, and that was sold at Walmart and Kmart and Super K. It was sold at all these stores, so it was really hard to round them all up and get them back. And I thought, good luck, because most of those foods are fast foods. You just go in and you just eat it, right? It wasn't going to be sitting on anyone's shelf. And then I saw this, and actually my friend sent me this. I said, I want to use it. People are fed by the food industry, which pays no attention to health, and are treated by the health industry, which pays no attention to food. That's what you said. And Wendell Berry is still alive. He's quite the activist for the environment. And he's a farmer, and so he has some really good quotes, and he's written some really good books. That's number one, treatment, and I spend a lot of time on that, but it's so important to people's well-being. So when you come to see me, I don't know about other naturopathic doctors, but I develop a treatment plan, and number one on the list is food as medicine. What should you be focusing on to get healthy? Herbal medicine is another big item that I have in my office, and not all naturopathic doctors carry herbal medicine, and I have it in several forms. I have it in capsules, a large repertoire of capsules, but I also have it in liquids, and I'll show you that right there. And I'm going to backtrack again. So you also see foods. So that's another thing that would be on your treatment plan, was what herbs should you add to your foods that you're preparing at home that would be medicinal and would help you get better. I know when we took our board exam, there's rosemary sprig up there. We all had a rosemary sprig on our desk because it helped with clear thought, brain function. So we wanted all the brain power we could get so we could pass the board exam. No other school probably had that. But I have probably about 350 tinctures is what they're called. They're the herb extracted into usually an alcohol base, so it's preserved, but that's actually how to get the medicinal properties out of the plant. It's not extracted the active ingredient out of there, it's the plant itself that's extracted into a tincture bottle. And with my repertoire, I can make cough formula, I can make a sinusitis formula, I can make a mood. I have one that's called M&M, Mood in Menopause. That was a really big seller. But my sore throat and the sinusitis for this time of year is really, really popular. So I can formulate anything. Arrhythmias. I remember when I was doing my training with my residency, he was putting together, there's this military guy, he ran 13 miles a day and he was pretty fit, but he had an arrhythmia. And so he whipped together this tincture, and I was, preparing for a board exam, so I knew that he was putting some toxic herbs in there, and I said, "Whoa, that's toxic," kind of whispering to him. Then he's like, "Watch this," and then he said afterwards, he was like, "Okay, now think it through. In this bottle that the patient's going to have, they're going to take 1 dropper of it, they're going to dilute it in water, and they're going to drink it. How much of that toxic plant do you think is going to be in that 1 dropper? A drop or 2." Not much. But so then he saw that, well, I'm just going to watch this. And sure enough, the man comes back in 3 weeks and he goes, "That was great, doc, fill it up." I didn't have a single arrhythmia since then. I'm like, oh, okay. And I wrote down all the herbs he used and the dosage. So I have a little notebook that I have from those days. It was great. So that's a really powerful form of medicine. That's really awesome. IV medicine, again, stands for intravenous. And there's a whole repertoire of different IVs that I can formulate in my office. So that's really nice too, and they all do different things. So vitamins and minerals might be for someone that it's going to be taking a trip and this wants a little booster. It might be for someone that had a gastrointestinal, maybe they ate some tainted food I was telling you about, so they've had a lot of diarrhea, so we're going to replace the minerals, replace their fluid. The high-dose vitamin C, like I said, is the most popular and common treatment for cancers, but there's so many others. Alpha-lipoic acid, which is the ALA, that also is a great cancer treatment. It's also used for mild chelator, for someone that can't tolerate the stronger chelation. Chelation, that word means it's like a horseshoe, and it grabs onto the bad minerals in your body, the mercury and the lead, and will pull it out of your body. So the chelation is also something we learned in medical school, and it is used quite often. Phosphatidylserine is a little bit more popular for cardiovascular disease, brain function. And NAD plus is something that's not very common around for naturopathic doctors. The MD I trained with used NAD a lot. His passion was infectious disease, immunology, but his other passion was addictions, because his father was an alcoholic, but he was also a brain surgeon, so he was brilliant. And so growing up in that environment, he was trying to figure out what causes dad to go for that bottle or bottles or cans, and why. And so he found that it was the brain that was causing the defect. It wasn't a defect of the person, it was the brain. And so he had two main treatment rooms, and one was for the immunology, the infectious disease, and the other one was for the repairing the brain. And I remember when I went to train with him, I said, who are those people in that room? Because they look pretty sedate. NAD doesn't make you sedate, it's repairing the brain, so it makes your brain kind of heavy, and so it's hard to participate in anything else. So it's best to be left alone and let the brain do its work, and by putting the NAD in, the bad stuff comes out. So it's like put in the good, the bad just goes out the door. So it minimizes the withdrawal, it minimizes the recovery. It's also great for Alzheimer's and dementia because it repairs the brain synapses. So it's really a nice formula. I like that one a lot. It's an intense treatment. It's usually anywhere from 10 to 5 hours a day, 5 to 10 hours a day. So 10 hours if you want to get off these medications that are addictive in nature, and 5 hours if we want to repair the brain. There's other special formulas that I have in my office that I can put together for eyes, for vision, for anxiety, depression, immune boosting, and also there's one for malnutrition that contains proteins, it contains amino acids. So that one is super nice for someone that is battling the opposite type of addiction, which might be anorexia or bulimia. That's a nice replacement. Or someone that's been really sick for a long time. And so that's a nice replacement. Also for someone that's battling cancer, especially if they went through chemo and they need to be built back up. That's an awesome formula. Very gentle, no side effects. It's just food in a liquid form. Number 4 treatment option that we have that's very different from the MD world is homeopathy. And this picture shows one remedy, they call them remedies, which is arnica. Arnica is probably the most popular remedy. They use it in the hospital, and I don't know if they still do that. Queens took it over, but North Hawaii had arnica. It's great for any kind of bruising or muscle trauma, but it can also be brain trauma, right? Because it treats the whole person. So traumatic event from a surgery, traumatic event from a car accident, some kind of traumatic event, but also great for your furry creatures, your furry friends. The 6C is something I would use for animals. The 30C would be something for mild bruising if you just got banged into a wall or something, or a corner of a desk. The 30C would be great. 200C is more of what I would prescribe for someone, which I just did for someone that's going in for a prostate biopsy. And so we're giving that to help heal the damage from the invasion of that next week. And then there's also higher potencies, they call them, but are only available from a physician. Okay? There's 1M and 10M. The other ones you can find at your health food store, and only they have what's called polycrest remedies. There are about 20 remedies that are very common and can be used for lots of different conditions. There's one for teething, and there's a couple of that are quite popular and common. Those can be available at the health food store, but anything outside of that needs to be seen by a physician. Yes?
Would that work for gout?
Good question.
uric acid?
I'm going to say that you have to treat this. Homeopathy works as long as there's no structural defect or obstacle to cure, so to speak. So if the blockage is a metabolism issue, then that might need to be corrected too. But in addition to it, we could do this. This is really good for acute or chronic conditions. So another good example is shingles. Homeopathy is really good for that. Really good for being on a boat and being a little seasick. So there's some really good remedies for acute. Great for kids. Profuse diarrhea, great. Vomiting uncontrolled, great. So there's some acute diseases and some chronic ones. So definition of homeopathy. It's a natural form of medicine. It's very old. It's been used for, again, acute and chronic conditions, and it believes that the body can heal itself. And then what I like about it is that it treats both the mind and the body at the same time. And when I'm looking for the right remedy to match the person, that's really what fascinates me, is oftentimes the mind, the depression, the anxiety, whatever it is, and the illness are matched in one remedy. So then I can treat the whole person that way. So sometimes it takes detective work, and this is really a science that you never stop studying from, because there's so many different remedies and some very rare ones, unique ones. Another old treatment approach is hydrotherapy. And this is an old picture, about the best one I could find, about how that kind of visually depict how that works. It's not a tank of water that some people think it is. It's not a spa. It's a spa-like treatment, but it's not a spa that you sit into, a jacuzzi type spa. We're using the science of water, hot and cold water, and the conductivity of water, but we're using it on towels on the chest cavity. And the heat will allow your circulation and your whole body to warm up and vasodilate. And then we're going to put a cold one on you, it allows it to vasoconstrict. So the Swedish use it when they jump into the ice water. So lots of different countries use it. This has been around, I think it came from Germany, and then it brought to the US by Kellogg. And it was made famous at Battle Creek, Michigan, at the Kellogg, they called it a sanatorium because that's what they called hospitals back then, was a sanatorium. And you stayed there and you got this treatment every day. By the time I was getting my training in natural medicine in this class, and then I did my rotation in the medical school and then my residency, once a week. And so I remember going, I don't see this patient, it wasn't my patient, it was his patient, but I don't see them really getting well. I don't see them making the change I would like them to make. So I go back to the school library and I pull out some old literature on hydrotherapy. And that's when I learned, you have to do it every day, or almost every day. I have a patient now that's seen, I don't know, maybe 5 doctors, another naturopath before me, and she was diagnosed with essential tremors. And she wanted them to go away. But her essential tremors were very tight grimaces that she would get locked in. So I told her, that doesn't sound like an essential tremor to me. That sounds more like a tardive dyskinesia. And she was going for Botox treatments to get it to stop. So I talked to her about doing this instead, and I pictured her to be very toxic, and we need to detoxify her, but we also need to balance out the nervous system. So this hydrotherapy has hot and cold, but also has a sine wave machine that's just a sponge pad that I first put behind on their back on both sides, left and right side. So it stimulates the organs of the chest cavity and calms down the nervous system. So you can digest better, you can breathe better, your heart can function better. And then I switch it to the liver and the gallbladder, and that's the detox phase. And she has now had 20 treatments, and she after she did 10, she goes, I get this. You did it. You hit the nail on the head. We have to do it often, and we have to do it. No one else mentioned detox to me. And so she's already so much better, and she can't wait till the Botox gets out of her system. I told her to take about 3 months. So she's a strong believer. She really likes this treatment a lot. So she comes in. She was coming in every day. We just switched her every other day because she's doing so much better. There's different types of hydrotherapy. The one I've been talking to you about is called constitutional. It treats the whole body. So the whole body is wrapped up, and you see that he's wrapped in in cotton, and then there's a wool blanket that goes over them. And it's great for kids as well. For kids, I call it you wrap them up like a burrito, a little burrito wrap. And so great for bronchitis, pneumonias, and if they're really sick, they don't mind at all. They like all that nurturing and loving up. So it's a really powerful treatment that seems so simple. Physical medicine, I mentioned to you that I do, and here's the repertoire of physical medicine that's available. Exercise is a great form of physical medicine if the patient can do it, and then maybe I have to, so we go to the doctor and might say, you gotta start exercising. And the patient be like, I can't. But maybe they can do Tai Chi, maybe they can do Qigong, maybe they can float in the ocean. So meet them at their level and get them started with the movement and circulation again. Chiropractic, I could mention that we can do that under our profession. This is an ultrasound machine, but not the kind that you've seen before, the ladies have seen for looking at the fetus. This is sending sound waves into the body, and it's great to heal up scar tissue. So if someone had a surgery and they still had limited range of motion, which happened to a cheerleader I was working with, and they went through all this PT, and she had to go back to either being a cheerleader in, she gave me 2 weeks, or she was going to lose her spot on the team, and she really wanted to play. She really wanted to participate in cheerleading. And so I said, let's do this. And so I did the ultrasound. Doesn't hurt, it just a little bit warming deep inside. And then right afterwards, I said, okay, let's see how your arm can work. And it went all the way up. And the mom starts crying. And the daughter, she's 16, she goes, Mom, stop it. You're embarrassing me, right? And she goes, do you know how much we've gone through already? And it was this easy. That's all it took was just one machine. So I just said, come back, we'll strengthen the ligaments, and then you're good to go. But there's other ones that I don't have in my office. The cold laser, the TENS unit is very common, easy to purchase on your own. Iontophoresis and microcurrent. Microcurrent is very interesting to me. I've taken some courses on it, but I do not have the machine. But ultrasound is awesome. I use it a lot. And the sine wave that I told you about that I use with the hydrotherapy. Okay, oxidative therapies. Now we're going into the modern era. So I really like this form of medicine, and I really like this form of medicine mostly because of my training with the MD, who is doing mostly immunology, is great at killing off infection. The MD world has a really hard time with viruses. They can throw up antibiotics, which kills bacteria, but they don't have much available for viruses, or tapeworms, or parasites, and other nasty creatures that might be living inside your body. So oxidative therapies is great. It's a equal opportunity destroyer of all living organisms because they can't live in an oxygenated environment. And here they are. Ozone, which is O3, not O2. So that's what makes it strong and powerful. Hydrogen peroxide is also quite effective. When I was doing my rotations, externship, there was a lady that came in and said, I want hydrogen peroxide. We didn't use it in med school. And so I just went up to her and said, it was my very last rotation. I said, why did you choose this method? And she goes, if I feel a cold coming on, I just call up the doctor and say, I'm coming in, because she said it'll nip it in the bud and it's gone. And I can go right back to work. I don't miss a single day of work. It's an 1.5 hour treatment, done. Vitamin C, I put it in here because vitamin C can be lower dose or a high dose. So high dose is oxidative, lower dose is antioxidant. So we have our choice of which way we want to formalize it for the patient, depending on what their condition is and what we want to treat. Hyperbaric oxygen treatment has been around for about 500 years, but it's really become vogue and outside of the diving world. It's now come into the medical world, and so it's become quite popular. And I have one in my office. I purchased one in July, and my patients love it. They might never ever go back to this because this is no needles. You lay down and you can even sleep for an hour, take a nap. So my patients, especially if they travel from here to Kapaa, which is my only place for my office now, this is a nice treatment for them. They find it really relaxing and therapeutic and gets the job done. I brought some flyers up here. There's many more of what conditions it can treat. I had a patient that had a stroke, unfortunately for him, on Christmas Day. I was open on Christmas Day, so we got him in the chamber. He was having a hard time talking, getting the words to come out. They told him it was a CIA. That's how he spoke. And yeah, I knew him before the stroke, and I knew that he was a writer. He's a children's book writer, so his language was phenomenal, and he was losing it with the stroke. So we got him in the chamber, and within 3 days, his dry sense of humor came back. So oh, you're back. So he's still partaking of it on a maintenance dose level just to be safe and protected. But it really does wonders for people that have a recent current stroke. Yes?
Is this the same thing that treats divers?
Good question. It's a little bit different. This one is called a soft chamber, so it doesn't have the highest atmosphere. So it's safer. It doesn't need additional oxygen inside. It works by compressed air, which puts oxygen into your tissues. I say from your brain to your big toe. It treats the whole body at one time.
Could it help the diver?
It would not be strong enough.
It would not.
Yeah.
Because
That's,
I have a lot of treatment there because I taught scuba diving.
yeah.
25 years, and I can honestly say too, I want to get a study done on this because I know my own body. Okay, just going scuba diving increases my oxygen tremendously, and they have a lot of studies on that. And your heart rate gets so much better, and that it pumps so much more efficiently. I mean, all exercise does that.
Mm-hmm.
But especially scuba diving, only because, and swimming, because you're in water, and you're using all your muscles, and so all parts of the body get super oxygenated. And I just went and did my own kind of therapy with this. I went back to Roatan, Honduras, where I learned how to work a hyperbaric chamber. I took the training to help. Because divers were getting bends all the time there. It was very, it's one of my favorite places in the world to scuba dive because they have a deep wall. But you have to watch your depth and you have to be careful. But deep diving really helped me get rid of all the fog that I accumulated over time being here when the volcano was going off. And I'm so glad you have this chamber because I'm very aware. But as far as a preventive thing, get in our ocean and swim because it does the same exact thing this thing does. You know, you don't have to wait until you're really sick. And that's what's so powerful about ND is she'll teach you and educate you about, preventive stuff. And then maybe you'll never need to do that. But if you did, I can vouch for that. That machine or that whole theory is very, very important for medicine.
Thank you for that. Yeah, it is I'm very grateful and glad that I have one. I like to use it myself too, and I used to dive a lot too on Oahu when I lived over there. So, and I do have a patient that works on a tour dive boat, and he also says that I'm gonna be so healthy. He has sinusitis that clears when he goes in the ocean, and so when he's not diving, it comes back. So we treat the underlying cause. Now it doesn't come back anymore. So feels like he's really healthy. All right, so this is kind of a closing statement. Experience a healthy and happy life with natural medicine because it doesn't do any harm. It gets you healthier than you were before you walked in the door, fixes what's wrong, and makes it not come back. Questions? Yes?
This one's kind of dangerous.
Okay.
Throw it out anyway. How much Ayurvedic influence do you have in your after the Indian Vedic teachings, for example?
We don't have a class in it per se in Ayurvedic medicine. There was a group of students that developed their own Ayurvedic meeting group to learn about that medicine and use it. And some naturopaths took that upon themselves to go ahead and use that branch of medicine more than others. I do use some of it though in my practice, especially for treating allergies, because there really isn't a good treatment for allergies and asthma, and suppressing, and that leads to a shorter life. So I use the Ayurvedic methodology and teachings that came from India, and my mentor moved it on to be more modernized and more accepted in the U.S. form of it, but it's awesome. Yeah.
And underlying Vedic, astrological, even in the 1800s, 1700s, the three humors, Rajas, Tamas, and Atas, expanding, contracting, and mutable, does that have much? I'm sure with all the tests you have, you've moved far beyond that, but you have that kind of presentation of the three different basic physical conditions, physical states.
Yeah, I don't want to get too out there for you, but but some people might say that I'm going to backtrack a little bit. But during medical school, pre-med, I was reading like Carolyn Myss. I was reading some books about medical intuitive, and I was like, oh, that'd be so nice to have that capability. And so that's what I mean about being a detective. When I'm listening to someone's story, because it's really their story, it's their story only, no one else's story. I start to see where a blockage of flow is. I use that term a lot. Or what organ is the most of nurturing or being more functional. And so I'll use those kind of terminologies, say the Ayurvedic words, but basically we're talking about the same thing. And the emunctory organs of the body, because we have to, that's our ways of detoxifying naturally. So just getting you back to that state of being. Good questions.
I'm an Ayurvedic consultant, and naturopath medicine we're very, very much in line with, and the key similarity is nature. We work with nature, and you're just, we use the 5 elements, which is in all of nature, in our own bodies, in air, fire, and you're just talking about qualities of nature. So that's just one little piece. And then there's body constitutions. Everybody, and naturopath definitely respects and honors that. And that's why she says you have to be a detective. In our Vedic medicine, we are detectives also, in the sense of if this person has lung cancer and another person has lung cancer, how I treat each individual is going to be very different because they have different constitutions and different paths, right? So, but the unifying effect, and even in allopathic medicine, which is MD, even in that medicine, they're working with nature, but they don't always trust it. We know and trust that the body can heal, and that's another basic.
And then there's
similarity.
Taoist, where you have the basic computer, yes or no? Where you at?
What's the basic?
Taoist, healing Chinese.
Oh, yeah, and Chinese and Ayurvedic are really one and the same in
Okay.
many ways.
There's a lot more questions right behind you.
Yeah.
Did you want to go first?
I think there might have been some, I'll just go. It's really tough thing on Medicare because I don't pay anything for Western medicine, and even though it isn't my preference. So to find out what your cost, obviously you need to know more about what's going on with me. What's the easiest way for me to get an idea of what it cost would be to work with you?
Free 15-minute consult. Just call me and say I want a free 15-minute consult.
Thank you. Thank you so much
Sure.
for offering that.
Yes.
If I called you up and said I would like to get something for depression or to sleep, you wouldn't do it without consultation.
Because there's all different kinds of depression and all different kinds of physical disability. So I wanted you to tell them that what kinds you have that can treat you for it works, right? There's physical responses, there's physical experiences, there's what happens when you don't feel safe, or not listening, and pain, what's the pain? So each person has to figure that out into that requires finding optimal care. That makes sense. So that can be the right medicine that will work for your patients. Yeah, you know.
So you can say that depression comes from all kinds of different reasons, right?
Yeah, yeah. So it can be from traumatic events, it can be from nutrition deficiency, it can be from, oh my goodness, lots of different things. So that's when you figure out what you can do. Good question, or great question. Ready?
Well, I was just going to ask what your rates were, I think.
Okay, so that might be, the consultation is $350. You know, for one time when you are having that treatment time. And in that treatment time, then he talks about what you need to do. If it's a office follow-up, it's $925. If it's treatment, it's just like the treatment, not the treatment only. And then if someone needs really, really sick and needs a lot of care, I'll offer them $350.
But you don't take Medicare or insurance?
I cannot take Medicare. If I do take insurance payers, the other insurance is going to count, and you can practice for them, and they become, the important thing is they become, not sure you can reimbursement. So my patient can practice for 10% reimbursement. For my patient, it's really good.
In that 15-minute consultation, are you willing, because I know I've done this in the past, but would you, like, okay, if someone says, oh, I have trouble sleeping, would you be willing to say, well, you know, there's this tea called Toasted Sleep, and that one has really helped people sleep through the night. Why don't you just try it and see if that helps? But if it's really chronic and that doesn't help, then then let's see, then come see me. Like, is that what the 15 minutes includes, or just?
No, 15 minutes includes that natural. 10 natural minutes. Well, the 15 minutes is different. Meeting me and people this way. But some people just cold call, so they take a train of voice, they just take a charge with me as a person, but also when I treat that condition. So doctors don't know that much about it. So can I treat it and how to treat it? And possibly what are the options so that she will follow at a low cost. So the company as well, and what things might be, where you want me. I might say to someone, it sounds like there's something that can be addressed in a consult and then a follow-up. And then she says, look, or this is something that requires treatment in the office. So, you might be able to do that. And you have a point to come up with.
Any other questions in the back? I don't want to take all the time up.
Right behind you have a question.
Can you be your primary caregiver?
Yes.
Okay, great.
Just 2 years ago, she was recognized as
So I'm hearing that the glass is half empty. What if we come to you just because we want to stay healthy?
Yes. Yes.
That's-
Yes, absolutely.
Okay.
I spoke at the university, med students, and someone asked me that, and I said, that would be fantastic. People came for prevention. I said, human nature is usually they don't go to the doctor, and I said, and I want to just, I'm in a pickle. I'm in a pickle, I need help. So that's usually the case. But yes, absolutely, come for prevention. Absolutely. Do you have a question?
Your consults go more than an hour and a half, or is it strictly?
They often do. They often do. And I'm generous that way. If the story needs to be told and it's important to the condition can be gathered, then I'll go over an hour and a half. So yes.
I could vouch you can go up to 3 hours.
Are you open every day?
I am.
What time do you?
I'm open on Monday through Friday, 12 to 5, and Saturday by appointment.
Well, even I was asking, I'm back there on Monday. What's Monday?
Okay, perfect. I'm there.
What's my doctor, my office, you give me in that office.
Oh, okay.
It's over.
Oh, no. I know.
So how far is Papa Al from here?
It's a beautiful
Diane, always sad.
It's a whale watch.
It's about an hour and 10 minutes, would you like this?
Yeah, I'll go on that too.
And all freeways, easy to use.
Yep.
And it's a great restaurant.
How about CDs? Do you have any nice meditation CDs that you might be presenting on the side? Anything that's audio? Because if you drive that long, it'd be nice to have a nice CD.
Well, you can be my marketing executive.
Huh?
You can be my marketing executive. You know, I used to, but that's why I went like this, use some CDs with my patients when you come in already. And that's the difference between water and email. More people are like, oh, hey, here, when they are like, it's a beautiful spot. Yeah.
Just listen to some people white.
Yeah. Thank you, everyone.